Welcome back to my channel. If you're new here, my name is Neil Galve and I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students or nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you are already subscribed though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, Fridays. Please make sure to subscribe now. Hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everyone! Isang panibagong Wednesday discussion nga ang alay ko sa inyo for today, and like you see on the display, this is all about nursing pharmacology, another nursing drug study natin. Entry natin sa inyong nursing pharma. And today we're going to have your Labetalol. Diba? Usong-uso to sa mga emergency cases natin, sa mga patients na suffering from severe hypertension. And today you're gonna hear all about Labetalol. Ngayon, if you haven't watched the other videos I created, other nursing pharmacology lectures I created under my channel, I'll be actually providing the link on the description box. Click the one out because I'll be putting it there together together with the other playlist I have on my channel. Napakarami ko na nga po. I have a lot, tons, hundreds, if not thousands of videos all for you, which is related to nursing education. Check them one out because it's going to be very helpful for your study. Now, I would also like to grab this opportunity to thank you from the bottom of my heart for all your love and support, for continually sharing my videos on your social media platforms. I loved a lot of you guys have been tagging me. Thank you so much for doing that. Na-appreciate ko po. I'm very grateful. Ano ba nangyayari sa arc ko for today's video? I am very grateful for all your love and support and kindness. Maraming salamat po. Ngayon, hindi ko na patatagalin pa dahil medyo juicy itong discussion na to. Without further ado, you guys, let me introduce you to our today's objectives. Alright, so today we're going to be tackling Labetalol and we're going to divide this discussion into chapters. So we have the first objectives is that we're going to discuss Labetalol in terms of classification, generic and brand name, route and dose of administration. We're going to discuss mechanism of action, indications, contraindications, adverse effects, and this will not be a nursing drug study and we're not going to discuss nursing responsibilities. Handa ka na ba? Hinga ng malalim. Eto na tayo. Oh, teka lang. Before I forget, before we jump into the formal discussion, I'm gonna give you time to subscribe. Go. O, diba? Ang simple lang. That's so easy. It didn't really... That was just like 3 seconds of your time. But thank you so much for doing that. You guys are amazing. Let's proceed. Classification, generic and brand name, route and dose of administration. If you haven't heard about Labetalol, this is the day that you're gonna be familiarized with this medication. Now let's discuss. This is pretty straightforward, you guys. Here's the graph, the table, and then we're gonna discuss this each one by one. So classification, beta blockers, alpha activity. So your Labetalol is under beta blockers. That's why it is an hypertensive medication, okay? Now, generic and brand name, Labetalol and Trendate, respectively. So this is sell under the brand name, commercial name, Trendates, okay? Now, in terms of route and dose of injection or administration, injectable, available siya into two forms. We have your tablet for oral, dosing and IV, injectable solution. Injectable solution, it is available in 5 milligram per ml, and in tablet form there's 3 doses available, 100, 200 and 300 milligrams. Okay, now these are the the dosage per indication or per situation or case of your patient. For patient who's suffering from hypertension, 100 milligram per orm Q 12 hours initially. Increased by 100 milligram Q 12 hours every 2 to 3 days. Usual dosage range 200 to 400 milligram per orem, Q12 hours or every 12 hours, not to exceed 2,400 milligrams per day. Hypertensive emergency cases, 20 milligram IV over 2 minutes initially, then 40 to 80 milligrams IV, Q 10 minutes. Total dose not to exceed 300 milligrams. Alternative. So we have 1 to 2 milligrams per minute by continuous IV infusion. Total dose of 300 milligram has been used. Max dose mo lagi, 300 milligrams. Dosing modifications, renal impairment sa mga patients who have mga diagnosed with CKD, AKI, or ESRD. Not studied, but no supplemental needed after dialysis. Hepatic impairment. Before I proceed, for patients who are having or receiving scheduled dialysis, tandaan mo na kapag sa araw ng dialysis nila, normally na-admit yan as in patient. Pag may schedule sila ng dialysis within that day, yung mga antihypertensive medication mo, such as Labetalol, any beta blockers mo, should be hold. Babagsak ang BP niyan kapag natapos ang dialysis, tapos binigyan mo pa ng ng meds sa antihypertensive, wag ibibigay. Okay? That's just a tip. Now, hepatic impairment not studied, dosage reduction may be necessary. Dosing considerations, monitor blood pressure every 5 to 10 minutes. Yes. Once again, this is the classification, generic and brand name, route and dose of administration of your Labetalol. Malinaw ba yon? Malinaw. Let's proceed. We're going to discuss about your mechanism of action. How does this medication works? Now, this is also pretty bookish, straightforward, but I want you to listen up to me, okay? Okay. All right, here we go. Ta-da! Labetalol non-selective antagonizers or antagonizes beta-adrenergic receptors and selectively antagonizes alpha-A or alpha-1 adrenergic receptors. Following oral administration, Labetalol has 3 times the beta-blocking ability than alpha-blocking ability. This increases to 6.9 times following intravenous administration. Antagonism of alpha-1 adrenergic receptors leads to vasodilation and decreased vascular resistance. This leads to a decrease in blood pressure that is most pronounced while standing. Antagonism of beta-1 adrenergic receptors leads to a slight decrease in heart rate. Antagonism of beta-2 adrenergic receptors leads to some of the side effects of Labetalol, such as bronchospasms. However, this may be slightly attenuated by alpha-1 adrenergic antagonism. Labetalol leads to sustained vasodilation over long term without a significant decrease in cardiac output or stroke volume and a minimal decrease in heart rates. O, diba? Balik-balikan mo lang yun. If you haven't get that at the first time, don't worry. I'm gonna be dividing this video into chapters. Balik-balikan mo lang. Okay? So once again, this is the mechanism of action. Let's proceed, you guys. How about the indications? So, which patients are you going to give this medication? That's basically it. Huwag masyadong pahirapan ng sarili. Okay. So, I'm going to give you 2 indications. One is Labetalol injections are indicated to control blood pressure in severe hypertension. Next, Labetalol tablets are indicated alone or in combination with antihypertensives like thiazides and loop diuretics to manage hypertension. Be careful with your thiazides and loop diuretics, ha? Kaya close monitoring tayo sa ating blood pressure because of the severe adverse effects of this medication. Baka mag-drop yan. Tandaan mo lagi na kapag nagba-manage tayo, kung ako personally, although ayoko mamili, if I'm gonna choose between hypertension and hypotension, I'll rather choose hypertension. Why? Because hypotension is so difficult to deal with. I find it really easy to deal with hypertension than hypotension. I don't know about you. That's just me. All right. So once again, this is the indication of your Labetalol. Let's proceed. Contraindications. But before that, Kasi medyo mahaba ito. Oh, I'm gonna give you time to subscribe to it now. Go. Thank you so much, you guys. Thank you so much for doing that. Now let's proceed. What are the contraindications? Meaning, which conditions of your patients would you not give or would you hold labetalol? Administration. That's the question. Okay, ang na-delay pa yung administration. Okay, mag-proceed na tayo. Eto na. I want you to listen to me very carefully because this is very juicy, you guys. Okay? All right. First one, you will now give labetalol to abrupt discontinuation coronary artery disease. Abrupt discontinuation of labetalol in patients with coronary artery disease may result with exacerbation of angina, myocardial infarction, or ventricular dysarrhythmias. When discontinuing chronically administered oral labetalol, gradually reduce the dose over 1 to 2 weeks. Gradual discontinuation nga po ito. Carefully observe the patient and advise them to limit physical activity, for this can cause orthostatic hypotension. If angina significantly worsens or acute coronary insufficiency develops, reintroduce labetalol at least temporarily and institute other measures appropriate for the management of unstable angina. In patients without coronary artery disease, abrupt discontinuation may result in transient symptoms. Example nito, tremors, sweating, palpitations, headache, and malaise or yung body weakness. Alright? What else? We have AV block, bradycardia, cardiogenic shock, heart failure, and of course, hypotension. May hypotension na nga, nagka-cardiogenic shock na nga, bibigyan mo pa ng labetalol, tatatidyakan kita dyan. Oh, here's the explanation why. Labetalol is contraindicated in patients with overt heart failure greater than first-degree AV block, cardiogenic shock, severe bradycardia, or other conditions associated with severe and prolonged hypotension. The negative inotropic effect produced by beta blockers can exacerbate heart failure, although use should be avoided in decompensated heart failure. Labetalol can be used with caution in stable patients. Continued myocardial depression can lead to heart failure in patients with latent cardiac insufficiency. If signs and symptoms of impending heart failure develop, fully digitalize and or give the patient in diuretic and observed closely. Withdraw labetalol therapy gradually if possible if heart failure continues. Monitor heart rate and rhythm in patients receiving intravenous labetalol. Before allowing ambulations, establish the patient's ability to tolerate an upright position and observe the patient at the time of first ambulation after receiving intravenous labetalol to limit the risk of what? Orthostatic hypotension, which is related to movement. Pull of gravity. Oh, di ba? Taray na. Ang haba no. Nagets mo yan. Very good. Hindi tayo chubobo for today's video. Next, we have your pheochromocytoma. Ano ito? Use labetalol with caution in patients with pheochromocytoma. Pheochromocytoma. Paradoxical hypertensive responses have been reported. Although labetalol has been used to effectively lower blood pressure and relieve symptoms in patients with pheochromocytoma, it is not recommended as an agent of choice for hypertensive emergencies related to pheochromocytoma. Pheochromocytoma, if I remember it right, this is the hypertension for children. Pedia patients. Okay? Okay. Ito tayo. Pinag-aralan namin to sa MS eh. Naalala ko lang. Yes, meron tayong knowledge. Hindi tayo dyan chibobo for today's video. Ano pa mga contraindications? Sabi ko sa inyo eh. Mahaba itong contraindication kasi nag-research talaga ako. Eto na, hypertensive crisis. You're not gonna give labetalol to patients who are having hypertensive crisis. Use caution when reducing severely elevated blood pressure. Example, hypertensive crisis. A number of adverse reactions including cerebral infarction, optic nerve infarction, angina, and ischemic changes in the electrocardiogram have been reported with other agents when severely elevated blood pressure was reduced over time courses of several hours to as long as 1 to 2 days. Kaya hinay-hinay sa pagbibigay ng mga labetalol. Huwag kayo para kayong tsubobo. Gusto mo na mapababa pa ng mapababa. May max dose lang tayo ng labetalol. Huwag ka masyadong excited, okay? Reduce blood pressure over as long a period of time as incompatible with a patient's clinical status. For adult patients with compelling condition, example, aortic dissection, severe preeclampsia or eclampsia, reduce systolic blood pressure to less than 140 milligrams, mmHg, na? Millimeters of mercury. Ano milligrams? Sorry, natawa ako. Millimeters of mercury, less than 120 millimeters of mercury in aortic dissection. During the first hour for adults without a compelling condition, reduce systolic blood pressure by no more than 25% within the first hour, then to 160 over 100 mmHg with the next 2 to 6 hours, then cautiously to normal during the next 24 to 48 hours. Who else would you not give labetalol to? Asthma, o diba, mga COPD patients. Asthma, bronchitis, chronic obstructive pulmonary disease, emphysema. Why? Labetalol is contraindicated in patients with asthma or obstructive airway disease. Example nga nito, yung COPD, pulmonary disease or chronic bronchitis, emphysema. If use is absolutely necessary, use the lowest effective dose so that inhibition of endogenous or exogenous beta agonist is minimized. If bronchospasm occurs, discontinue labetalol immediately and treat as appropriate. Kasi nga, labetalol can cause bronchospasm. Kaya big no-no sila. Very cautious ka sa mga pasyenteng may COPD or may history ng asthma or active case ng asthma, okay? Push dyan, magbasa ka. Ito tayo sa children diabetes, mellitus, and vomiting. Non-selective beta blockers may inhibit catecholamine-induced glucogenolysis and lipolysis, predisposing to hypoglycemia. Additional beta blockers can mask signs of hypoglycemia, example tachycardia, and increase the risk of severe or prolonged hypoglycemia at any time during treatment, especially in persons with diabetes mellitus or children and persons who are fasting. Example nito, yung mga patients who are going to have surgery, not eating regularly, or patients who are vomiting. Persons should be instructed to seek medical treatment if severe hypoglycemia occurs. Beta blockers can also occasionally cause hyperglycemia. This is thought to be due to blockage of beta-2 receptors in pancreatic islet cells. Beta-2 receptors on pancreatic islet cells, which inhibit insulin secretion, monitor blood glucose concentrations closely if a beta blocker is used in person with diabetes mellitus. In addition to acute blood glucose effects, beta blockers have been shown to increase the risk of developing diabetes mellitus in adult hypertensive patients. Evaluate the risk relative to the proven benefits of beta blockers in reducing cardiovascular events. Naloka ka ba sa haba ng contraindication? Hindi pa tayo natatapos niyan, kunin ko lang yung kape ko. Wait. Saglit. Medyo mahaba-haba tong contraindication na to. Saglit lang, class, ha. Pwede naman tayo uminom ng tubig for today's video. Okay, very good. So where are we? Okay, tapos na tayo sa children diabetes mellitus and vomiting. We are now going to the second contraindication, which is, let me just do something here real quick. All right, coronary artery bypass graft surgery, or what we called cabbage. Okay, why is this contraindicated to patients post-cabbage? Do not routinely withdraw beta blocker therapy before surgery. Evaluate the risk versus benefits in individual patients by considering the type of surgery, example, cardiac versus non-cardiac, coexisting health conditions, and anesthetic strategy. Guidelines recommended continuance in patients already on beta blocker therapy. However, initiation well before a planned procedure and careful perioperative titration to achieve adequate heart rate control while avoiding significant bradycardia or hypotension are suggested. In an uncontrolled study of patients after coronary bypass surgery or graft surgery, or what we call cabbage, patients with low cardiac indices and elevated systemic vascular resistance after intravenous labetalol experienced significant declines in cardiac output with little change in systemic vascular resistance. One of these patients developed hypotension after labetalol treatment. Therefore, avoid labetalol use in such patients. Cabbage patient, wag bibigyan ng labetalol. Ano next? Hepatic disease. Bakit to contraindicated sa mga patients with liver disease? Ito siya. Use labetalol with caution in patients with hepatic disease due to decreased drug metabolism. Bakit? Saan natin to saan daw to metabolize? Sa liver. Malinaw yon? Malinaw. Severe hepatocellular injury has rarely occurred after both short and long-term treatment and may be slowly progressive even with minimal symptomatology. Okay. Monitor liver function tests periodically and at the first sign or symptom of hepatic dysfunction in patients taking labetalol. If jaundice occurs or there is severe evidence of liver injury, discontinue labetalol and do not restart. What else? We have your beta blocker hypersensitivity. Well, labetalol is contraindicated in patients with a history of hypersensitivity to any component of the product. Cross-sensitivity between beta blocker hypersensitivity can occur. While taking beta blockers, patients with a history of severe anaphylactic reaction to a variety of allergens may be more reactive to repeated challenge. These patients may also be unresponsive to the usual doses of epinephrine used to treat the allergic reaction. What else? Ang haba, diba? Mahaba to, sabi ko sa iyo eh. Laboratory test interference. Anong ibig sabihin nito? Labetalol may cause laboratory test interference. The presence of labetalol metabolites in the urine may result in the falsely elevated concentration of urinary catecholamines, metanephrine, normetanephrine, and vanillyl mandelic acid, yung tinatawag nating VMA. When measured by fluorometric or photometric methods, use a specific method such as high-performance liquid chromatographic assay or assay with solid phase extraction for determining catecholamine concentrations in patients suspected of having pheochromocytoma. Sa mga bata ito. Okay? Next, we have your ocular surgery. Patients treated with alpha-1 blockers including labetalol may be at risk for intraoperative floppy iris syndrome, yung IFIS. During cataract ocular surgery, there does not appear to be a benefit of stopping alpha-1 blocker therapy before surgery. However, the possible modifications of surgical technique, example nito, yung utilization of iris hooks, iris dilator rings, or viscoelastic substances, may be What necessary? IVIS is characterized by the combination of a flaccid iris that billows in response to intraoperative irrigation currents, progressive intraoperative meiosis despite preoperative dilation with standard mydriatic drugs, and potential prolapse of the iris towards the phacoemulsion incisions. Nalunod ka na ba? Nabombard ka na ba? Ito na tayo. Contraindicated din siya sa geriatric. Adult, severe, elderly. Caution geriatric patients about the possibility of orthostatic hypotensions or symptoms. Some patients 60 years and older have experienced orthostatic hypotension. Ano pang pwede nila ma-experience? Dizziness or lightheadedness during treatment or during treatment with labetalol. When using the injection, establish the patient's ability to tolerate the upright position before permitting ambulation. Okay? So, hindi rin siya bibigay sa caution ka sa mga geriatric dahil sa orthostatic hypotension. Pregnancy. Bakit naman siya contraindicated sa mga buntis? Labetalol crosses the placenta, period. Extensive experience with the use of labetalol during human pregnancy based on published intervention and observational studies has not identified a drug-associated risk for major birth defects, miscarriage, or adverse maternal or fetal outcomes. However, most studies reported the use of intravenous labetalol after 20 weeks gestation. These studies cannot definitely establish an absence of risk during pregnancy, as there have been inconsistent findings of intrauterine growth retardation, preterm birth, and perinatal mortality with the maternal use of labetalol during pregnancy. Hindi mo siya ibibigay sa mga pregnant women. Okay, breastfeeding. Dahil nga nagkakross siya sa placenta, consider the developmental and health benefits of breastfeeding along with the mother's clinical need for labetalol and any potential adverse effects on the breastfed infant from labetalol or the underlying maternal condition. Small amounts of labetalol, approximately 0.004% of the maternal dose, are excreted in the human milk. That's why hindi siya binibigay sa mga nagbe-breastfeeding. Kanino pa? Infertility, reproductive risk. Bakit? Beta blockers including labetalol may be associated with reproductive risk and cause male infertility via erectile dysfunction and inhibition of sperm motility. Natapos rin tayo sa contraindication, you guys. Ang haba, di ba? Wait lang. Mag-subscribe ka muna, go. And thank you so much for subscribing, you guys. Eto na tayo. Mabilis na lang to mga susunod. Huwag kayong mag-alala. Diba? Very thorough. Eto na tayo sa iyong adverse effects. So what are the adverse effects of labetalol? Eto na po tayo. First one, you have your dizziness, lightheadedness, nausea, tingling sensation of scalp, fatigue, elevated serum blood urea nitrogen BUN. That's why you need to have serum BUN. Elevated serum creatinine, liver function test, kidney function test. Congestion of nasal sinus, orthostatic hypotension, kanina pa natin dinidiscuss yan sa mga geriatric. Absence of ejaculation, may mga erectile dysfunction, impotence. Paresthesia, numbness. We have your elevated liver enzymes, diaphoresis, edema, bronchospasm, kaya no siya sa mga may asthma, dyspnea, pruritus, rash, altered taste sense, altered taste sense, and ventricular arrhythmias. Kaya ingat-ingat ha, baka magkaroon tayo ng mga mag-arrhythmia yan. Huwag kang push ng labetalol. Para kang bobo ka dyan. Okay? Eto na tayo. Tapos na tayo sa ating adverse effects. Mag-proceed na tayo sa iyong nursing responsibilities. Diba? Ang bilis. Final, part ng ating lecture. Eto na tayo. What are the nurse as a nurse? What is your role? while giving or before giving your labetalol. Monitor blood pressure frequently. Know the target set by the physician. You should have a targeted goal for your blood pressure. Normally, basta ang MAP mo is above 65 mmHg, millimeters of mercury. Administer antihypertensive medications as prescribed. Have 2 large bore IVs para sa bolus ng mga saline mo dyan, or para better administration, check mo rin yung patency ng mga linya mo. We have provide oxygen if the saturations are low or less than 94% ang target O2 saturation mo. Kapag COPD naman, acceptable naman ang 88. Limit fluid intake if the patient is in heart failure. Ayaw mo magkaroon ng congestion. Assess ECG to ensure the patient is not having heart attack. Mga arrhythmia. Next, check report of the chest x-ray to ensure the patient is not in heart failure. Baka may congestion na nga. Next, listen to the heart for murmurs and lungs for rales and crackles. Congestion pa rin to. Check if the patient has edema. Baka naman kasi nagkakaroon na ng one of the sign, edema, fluid retention ng pasyente. Check renal function and electrolyte levels. Very important. Encourage rest and provide a quiet environment. Huwag mong patayuin yan. Baka ma-fall ka pa dyan. Educate the patient on how to lower stress. Taray, di ba? Educate patient on low-salt diet, exercise, and healthy eating. Ito naman sa mga pasyenteng ambulatory, ready na for discharge. Ito na tayo. Educate the patient on the importance of taking antihypertensive medications regularly on time. Compliance to medication. Again, sa mga pasyenteng MGH, may go home. Diba? Thank you so much, you guys, for watching. I hope you learned something. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Abangan mo nga yung upload natin this coming after 2 days or 3 days from now. Because that's going to be amazing and a lot of fun. Tulungan mo na nga ako, pamalitan mo na pamalitan mo na sa radyong sila ang pinakabago, pinaka-fresh at pinaka-libreng nursing review center sa balat ng YouTube. And I'll see you again on my next video. Don't forget to follow me on all my other social media accounts. Everything is at Neil Galve, except for my TikTok account, which is Neil Galve Official. I do have a podcast channel. Speaking of the podcast, I've been trying to upload my episode, but I'm encountering some problems, technical issues. I don't know why. Excited pa naman ako i-share sa inyo yon. But I do have a podcast channel. I'm gonna figure it out how to deal with it. It's 3 a.m. Conversation with Neil Galve. It's available. The link is also on the description box. So, you can listen to it on Spotify. So, download mo na para mapakinggan mo ako, diba? So, see you again and you have a good one.